Congratulations, Alzheimer's is one of the fastest growing and most debilitating diseases of our time. It not only causes serious memory loss, but often leads to loss of independence and eventually death. Joe Montminy was diagnosed with Alzheimer's at age 54. His doctor gave him a grim prospect.
That I may not recognize my family in 5 to 7 years. And then she's like, she told me I had a 10-year life expectancy. You know, we were shocked. I've been fortunate that my progression hasn't been as bad as they expected, but we have seen declines, and it's hard. It's a challenging disease.
Scientists, together with pharmaceutical companies, say they develop drugs that can slow down the disease by up to 7 months and possibly longer by removing so-called protein plaques from patients' brains. Still no cure, but it's considered a breakthrough after decades of failing to find medicines that work.
The opposite, actually. I think these drugs give us hope that we can do things. These are the first drugs of a new generation. Okay, they're not the end of the story, the beginning of a new story. Sure, there's safety concerns. There's safety concerns with any drugs. The thing is, we know what those safety concerns are, like you mentioned, this swelling or this bleeding into the brain, which sounds very dramatic, but it's something we can monitor.
Scientists here at the world's largest gathering of Alzheimer's researchers call it a start of a new era, with Alzheimer no longer being an untreatable disease. But others are more skeptical. Those scientists accuse the pharmaceutical industry of giving patients false hope.
Dutch professor Marcel Olderrickert says the new drugs don't have enough benefits for patients. He urges scientists and the industry to focus more on other causes of Alzheimer's than only protein plaques.
It's clear that these have been more or less neglected, as the pharmaceutical companies are now focusing on something which is close to the market. And they want more and more, and all the companies, when they see that it's more or less giving profit, then they also want a share of the profits.
It's estimated that donanemab will cost around $26,000 per patient per year. The company hopes to receive approval to sell it in the United States somewhere next year. It could take longer before it will be available in the rest of the world. Step Vaesen, Al Jazeera, Amsterdam.